I know this is definitely not going to be cute, and I probably won't delete this later, but I am pretty heated, and I want to get how I'm feeling and what I just experienced documented and to share, because I know this is going to speak to someone. I just went and saw the same doctor 10 years ago that told me to cut my thyroid and my uterus out as his explanation for my abnormal thyroid levels and endometriosis pain. 10 years later, I have both organs, perfect blood work, perfect as they're gonna get for those two organs, with no complications, no symptoms, and I'm doing just fine. So my dad, and granted, I'm doing this while I am driving because the appointment was at 10 o'clock. It's 11:40. I have my own clients to see, and my parents are still in there with him because of how long the wait is in medicine. That's another problem for another day. Okay, so we went to see the same doctor who told me, cut your thyroid and your uterus out. That'll solve everything. Probably the biggest endocrinology clinic in our city. You can read their Yelp reviews. I won't name any names here, but you'll know who I'm talking about. And today we presented literature, information, blood panel results that indicated that my dad does not need to be on his statin drug that has been erroneously prescribed for the last, gosh, how many years. And what I find fascinating is I ran further testing, more testing than he's ever ran. I ran an MMR lipid profile, homocysteine, a CRP, a full lipid panel, and his risk for cardiovascular disease is low to moderate. And we made big changes starting in January. And it is the very first week of May. And his triglycerides have dropped by 107 points. His cholesterol is all within normal range. And now his CRP has gone from 9 to 1. His blood work shows that his risk is low. Now, his good cholesterol, the HDL, is now trending lower than I would like it to be. It's still within their ranges, but functional medicine ranges for optimum hormone and brain cell production too low, because he's taking a drug, a statin, that prevents CoQ10 synthesis and cholesterol production in the body, which we need for hormones, for brain health. So my dad's been given this very loose, undefinitive diagnosis of Parkinson's. All the symptoms have been there. He no longer has a tremor. He no longer shuffles his feet. His memory is improving. His handwriting's improving. He's no longer falling. He's getting much better. He's a type 1 diabetic, so he's had diabetes since he was young. And I would say he was type 1.5 diabetes for a while, just uncontrolled blood sugars, poor diet, the whole thing. You're gonna have to forgive this shaky camera. I'm fired up, but I'm driving also my dad's truck, and this thing is a beast, so it shakes me around. Okay, so getting back to my point, and this is what, after all this rambling and background, here's what I want you guys to hear. I brought the literature, I brought the blood results, and this was this physician's answer to me. Do you know what I do when I'm not here with patients? My dad said, you watch basketball. And he got a little angry because he's a basketball team sponsor. I don't want to give him away. He didn't like that so much. He goes, I review peer review articles. I review journals. Well, shoot, buddy, so do I. And shoot, buddy, I might know something that you don't know. I don't know all that you know, and you don't know all that I know. And then I asked him, why are you keeping my dad on a statin when I'm bringing you all the information? And he's like, well, I'll look at it. He's not gonna change his mind. He goes, well, I follow the American Cardiac Association, the Diabetes Association, and all these associations, all of these ironclad structures that you don't ever question. And if you do, you're a bad doctor and they'll take your license away, or a nurse practitioner. I follow that, so I'm good. So I'm a good doctor. And I'm like, so does that mean that every person with diabetes and these numbers you put on a statin? He goes, no. And then he comes around to say, I have him on the statin because I follow the recommendations. I say, well, what do those recommendations say? He couldn't tell me. Why are we following recommendations when we don't question the narrative? This is way deeper than a medical issue. This is like our spiritual health, the way we see the world. Like, what reality are we living in? We're just doing what other people are telling us to do without questioning the narrative when we put things in our body. What in the world? The evidence-based literature, which I'm going to take to him in paper copy, says that a statin is not indicated for this patient. Yet because the associations are telling him to put this patient on a statin, he won't take him off of it. Okay, so my dad's going to have a hard choice to make and decide, do I want to go with the evidence, or do I want to go with the system? And I'm going to let him make his choice. I think he's going to make a good choice. But no wonder we're scared out of our minds when we go. My dad in this doctor's office, he's a veterinarian. He's just as smart as this dude. Foot tapping, nervous, because we give our power away to people who are following a system, who are following literature studies that are funded by pharma in the system that's the very drug that they're taking. And my dad has said it best. He said, I'm preferring these younger practitioners, his physical therapist, his nurse practitioners, anyone on his team. He said, because they seem to have more of the literature. And I'm not saying that my dad sees it all, but he does see through this process. He's like, and he told me, he's like, I've seen this doctor for 25 years. He hasn't helped me. He's like, functional medicine has helped me more in 4 months than this doctor has in 25 years. And what kind of world are we living in? Why do I care about telling other people this? Because we can wake up, we can be the change. We can say, you know what? I'm going to make my own choice. I'm going to make my own decision. And I talked to this physician and I said, I want us to have a collaborative team. And I think my dad's afraid that he won't be able to come to this practice and continued care. And his goal is a collaborative team. But how can a team be collaborative when both sides aren't willing to come together? And I'm not saying I have all the answers, but I'm clearly presenting you why this person who's having memory issues and has a history of muscle weakness doesn't need to be on the statin drug. And the best you can say is, I'm following the recommendations. Well, I'm sorry, sir, but your recommendations don't have the literature. They don't have everything up to date, and they don't have the patient's best interest in mind. They have the system and brainwashing our practitioners in mind. That's what they care about. And I'm not anti-pharma. My dad's a type 1 diabetic and would be dead if we didn't have pharmaceuticals. He doesn't have a thyroid, radioactive and removed. And his thyroid has shown no response to other interventions other than medication. Okay? He would be dead without medication. It's not anti-pharma. It's be for the evidence and think for yourself. And I think all doctors need to hear this.